Welcome to the University of Washington School of Nursing Voices of Nursing podcast, where we dive deep into the diverse and inspiring stories from the heart of healthcare. This is Voices of Nursing. On this episode of the Voices of Nursing podcast, we continue our conversation with Dr. Monica McLemore, a preeminent scholar of anti-racist birth equity research, community-informed methods, and policy translation. In part 2, we turn our conversation to critical topics around reproductive health, rights, and justice. Thanks for listening, and join the conversation on this episode of Voices of Nursing.
So for me, and this is where nursing, I think, we've spent way too much time in acute care settings and hospitals. But this is the work of public health nursing, right? Nobody knows what nursing looks like outside of our employers. And that's another thing I'm working on right now, because I actually think for too long, our employers have dictated what nursing is and what it is not. And so until we as a discipline and as we mature and as we continue to become more sophisticated in our knowledge production, one thing I'm really going to be working on is nursing role outside of acute care settings. I've always worked in outpatient setting. But Lauren Underwood and Cori Bush are really disrupting what it means to what nursing looks like in Congress, right? I say to people all the time, 6 physicians signed the Declaration of Independence. How would healthcare look differently if we infused ourselves in other disciplines and other domains? I thought that was the whole purpose of accelerated programs, taking people who have baccalaureate degrees in other fields and bringing them into nursing. Why don't I know any nurse architects yet?
That is a great question. And as a person on the marketing team, we could talk about that a little bit more. Maybe off mic, we can get into that.
Right. Think about it, right? Why didn't we bring in a whole cohort of architects to become nurses? Then we wouldn't have to work around, when we're designing clinical environments or when we're designing spaces to work, we wouldn't have to be the queens of the workaround, because we would have architecturally informed people who knew enough about nursing that could co-design with us the kind of spaces we need to work in. Why isn't that a thing?
Have you written that down somewhere so we can come back to that? I feel like
that's not a thing.
That is just such a great, that's just such a,
right?
Oh my goodness.
Why don't we have hedge fund managers that's nurses? Right? We the largest of the health professions and the most trusted. So we should be controlling money in the country, don't you think?
Right, with the perspective and understanding that nurses specifically
Am I the only person that thinks this?
No, you got 4 people definitely in here locked in.
So for me, it's like, if we're going to bring people into our discipline that have other degrees, how have we optimized those skills, right? Why don't we have, tax attorneys who are nurses that can help with the medical debt and all that? I could keep going.
The list of the problems goes on.
If we nationalized a whole lot of things.
That's it. I love that.
So, I don't know. The older I get, the more I am seeing opportunity and possibility. And this is why I get so frustrated and angry when I feel like nurses are navel-gazing or we are looking too internally at our own selves and not changing the world. Because what's the point? When are we going to spend some of that most trusted currency?
Right.
I've been asking this question for a decade. When are we going to spend some of that currency? And how collectively are we going to do that? So to tie this back to the institutions, we can't let our employers drive the agenda. Which ties back to my need to activate students so that they don't get in that mindset that employers tell you what nursing is and is not. I have people who think that hospital policy and procedure actually dictates nursing practice. And I have to say to them, have you read the State Nurse Practice Act? Right? So institutions exist for a reason, and they are signposts to assist us in how we want our society to be structured. And when institutions stop being effective, then they go the way of the dinosaur, right? There were many of us in Gen X who saw the death of Blockbuster coming because of the streaming of Netflix. right? There were many of us who saw the death of the phone book because of the environmental impact of the trees and knowing that digital stuff was coming, right? So what else do we see now that nursing and public health could effectively be preparing for shifts and changes? So, yeah, I think a lot about institutions because I'm not willing to see that institutions have lost their usefulness. Institutions are currently being led by fear, which is a different problem. And fear-based leadership is not helpful. So to me, it's more of how do we start to grow and have a wider, deeper bench or a crop of new leaders, and that's where activating the learners comes in. Does that make sense?
It does, and it's so...
There's a method to my madness.
It's very encouraging because listening to the way that you're talking about your expectations and thoughts when it comes to institution it's very aligned with how I see organizations, which is why I usually don't look to institutions. And
right.
You're really challenging me right now to shift the way that I think because I have actively disengaged with institutions because I just did not believe that they have the capacity or the ability to create like revolutionary change. But what you're saying is the revolutionary act is choosing to care for people first and using that as your North Star and all the other things that you do. Because if we care for people first, then we put the people who care for people first in a driving position.
Right. And I'm going to blow your mind even more on this one because like here's the other thing, right? No, I mean, and this is another inconvenient truth, right? I wrote a paper about retrofit reform and reimagine because we all aren't using the same approaches and we're all not having the same conversation. And we need all three of those things. I'm on team burn it down too, but we got to get our people out first. And that means we have to retrofit the harmful institutions or we have to hold them accountable. While somebody else, see, here's where trust and human interaction comes in, right? We got to trust that somebody else is building something better. But you can't be doing both, right? Like I can't be running around creating a community-based organization while I'm trying to hold it down in academia and hold them accountable to not harming our learners and providing them the tools they need to change the future, right? That's how you die at work, right? Okay, so, but I have to trust that the affiliate centers, that the Black Mamas Matter Alliances, that the National Birth Equity Collaboratives, that all those community Mama Toto's Village and Root and all those reproductive justice organizations, Sister Song, Sister Reach, Sister Love, they are all creating that infrastructure or they have access to the resources that they need to create that infrastructure so that when it is time to burn something down or something goes the way of the dinosaur, that we will have something better.
Refuge. But not even just refuge, a place to thrive.
We'll have something better, right? Because, I mean, think about it. The way that certain states that will remain nameless, Florida and North Carolina, are dismantling public education.
Right.
What's going to replace that? Who is going to be able to get people fact-based information? It's going to be the reproductive justice organizations and the other social justice organizations on the ground holding it down. It's going to be the harbingers of truth, right? So they need infrastructurally to be able to do that function. If we continue to have fear-based leadership who, respond to the Supreme Court of the United States, we can't use affirmative action now in our admissions, and we know the next place that's coming to is hiring. Okay, don't cede that ground yet.
Fight harder.
Fight. So from where I sit, I turned 55 this year.
Yeah.
Okay, so let's start that. In December, I'll be 55. And I'm starting to really think about how disruptive I'm going to be, particularly since it's an election year. And in my field, there are two cases that are going to come before the Supreme Court that, directly impact my work. We can't cede the power in the now of institutions. They may be obsolete in the future anyway. But in the now, we need them, whether it's professional organizations or the levers of the federal government. I say this all the time. Philanthropy, for-profit, and the government all have different functions and roles to play in the health of its citizens as well as its well-being. Nobody has the purse strings of the federal government. Nobody. That's why, as flawed as they are, I'm not willing to cede, their responsibility in continuing to fund the largest amount of biomedical research infrastructure in the world. So to me, yes, I've never had federal funding, but I still advocate for people to go after it. My learners and students have. Private philanthropy will never match their purse strings. It just won't. So, and when we have public insurance that the people we serve rely on, Medicare and Medicaid, and then you have SSI and disability, there has to be alignment and synergy for the health services and public health interventions they have access to. So we can't just be like, oh, well, no, we ain't gonna mess with the federal government. Hello?
Right.
How is that a thing? When half the births in the United States are covered
because of
Medicaid.
Yeah.
So it's a both and I'm trying to get people to understand that I have disengaged from institutions, and the way that I think about it is, if I divest from your organization, you've really f***ed up, right? I mean, messed up, excuse me.
We're going to be, okay. You're fine.
Right? Because if I have decided that I'm at a point where I have to deprive you of my presence and my brilliance and my attention, then that means that I am gambling on the fact that you will continue to do the work that you're doing and you might improve, but it's going to take some other person or some catalytic event for you to do that. So, yeah, a perfect example of this, the Association of Women's Health Obstetric and Neonatal Nursing, AWON. I'm going back to AWON this year after divesting after 2021. And like many institutions, it was the wake-up call of the murder of George Floyd that allowed them to restructure their organization to believe that mistreatment and racism were happening and were the root causes of poor maternal health outcomes in the United States. But I had to leave them because clearly they didn't believe me when I tried to tell them this in 2016 and 17 and 18. Right? Sometimes you have to leave. Let me say it this way. Sometimes you have to deprive institutions of your presence and your brilliance and your wisdom and let them fail on their own. Right? And because otherwise you're going to spend all your time trying to save them, bumping your head up against the wall, being frustrated. And it's a defensive and a reactionary stance. And people don't do their best thinking when they're in a defensive or a reactionary stance. At least I don't. Right? So we have to hold the tension that some people are around and they're going to hold it down. They're going to retrofit whatever institution it is. I'm a Black professor for a reason. I never had one. I have 3 degrees from public institutions. I've only had one Black professor once, and that was in public health. So one reason that I'm interim, I'm going back to the classroom. The students they deserve to be able to have access to me. I want to engage with them around these really difficult times we're currently in, because collectively, I think we can figure it out. Right? If equity, diversity, inclusion, and anti-racism are new to you and it makes you hella uncomfortable, let's figure this out. Because guess what? You're going to be serving people who understand exactly what equity, diversity, inclusion, and anti-racism are. So whether or not you're personally uncomfortable, professionally, in order for you to be a reasonably prudent nurse, you're going to have to know how to adequately and appropriately care for people who have been historically excluded or historically harmed by those structures. That's a skill, not a personality trait, right? So, and working with students to work through that in partnership. Because here's the other inconvenient truth I say to people all the time, and they're like horrified when I say it. If there is a story where I'm your villain, something's really wrong, right? Because I am not actively trying to be anybody's enemy or anybody's villain, right? I am trying to bring that nuance, that discomfort, that tension, those hard conversations that we all need to have as adults, not to convince you of anything. I want those conversations so we all can have an understanding of what the landscape is And for too many times, we've bought into these heuristics or these shortcuts, and it's lazy. Human life, human interactions are hard. They're messy. They're complicated. We're not all going to agree. We don't have to. But there is a shared goal and a shared understanding that I thought we all understood, at least as nurses, or people who are in the health professions, or people who serve the public. And that is this, that we meet people where they are to get their needs met, and that people deserve really good care. Like, if we all ain't starting there, then we need to have another conversation, right? And in order to be able to be in service, you have to be able to have some skills. And one of those skills is, it's not about you, right? That caring is a process. That, witnessing the transition of illness to wellness or diagnosis to treatment, that's our job, right? And to assist people with comfort in doing that. So, yeah, it is fascinating to me how things get framed, or these false dichotomies or these false binaries of how we got to have either or pitting stuff against each other. All that makes me crazy. I can't even be bothered.
No, go ahead.
Thank you for bringing this conversation to a higher plane. I'm just going to take these questions. I'm just going to goodbye to the questions.
She wasn't.
So we'll need to have.
Wait, but no, we got to talk about events.
We need to talk about some events. So one of the things that we want to share with our listeners is that you're going to be featured in an upcoming documentary that will be released May 10th called Shift.
Let's do this chronologically though, because it's easier for me to think about.
Let's do it chronologically, please.
So one of the reasons why I am a public scholar, is because I want to get more people excited about nursing and public health sooner, right? We need to be doing like K through 12, like hey, this is what we do. You can serve the public, like here we go, right? But, in the midst of Black History Month, I wrote about two public health poets that I respect and admire deeply. Dr. LeConte Dill, who is in Missouri, and Dr. Ryan Pettaway, and he is at OHSU. And Dr. Pettaway is going to be joining us at the University of Washington. I'm so excited. He'll be physically and virtually at Tacoma and Bothell. And if you don't know him, he is a public health poet. He is brilliant. And, we are going to be in conversation with him, myself, and our good colleague, Dr. Wendy Barrington, who runs the Arts Center, which is the Anti-Racism Center and Community Health. She's a nursing professor and a public health professor like me. We're going to be in conversation with him on February 20th. And there's a Zoom link and a QR code. It's all over my socials. I'm myself everywhere except for Twitter because I got tired of the Nazis and I finally closed my account. I was very mad because I have 40,000 followers.
That's a reasonable reason.
I didn't know you were leaving, but yeah.
Speaking of leaving,
sometimes you just got to go.
Right.
But I'm McLemore, M-R, everywhere. I've posted the flyer. The QR code is on LinkedIn, on TikTok, on Instagram, and on Facebook, and Threads. So we're going to be with him for Black History Month and to talk through his incredible work on February 20th, and that's from noon to 1. And he has other activities on those campuses in Jody Early's class and Robin Evans Agnew's courses. Super excited to be hosting him. March is Women's History Month, and I'm so excited. There's so many really exciting things that are coming from the Gender, Women, and Sexuality Studies program, of which I'm an adjunct professor as well. That calendar I'll also make sure that you have, and I'll be posting on my socials because Women's History Month is really important this year. Not just because of the anniversary of the signing of Lilly Ledbetter and the Fair Wage Act, but as we continue to think about the gifts of the Dobbs decision, which basically ended the federal protections of Roe versus Wade in the United States, we get to reimagine what the world of work, the world of health looked like for pregnant, capable people in uterus having folks. And one of the things I want us to really think about is we always knew Roe wasn't the best we could get. So what are we going to replace that with? And how can we operationalize or activate our citizenry to demand better? I mean, we've seen wins in Montana and Kansas. You either believe the Pew charitable polls or not, or the Gannett polls that the public is with us when we work on repro, or you don't. Everybody was all surprised. Oh, well, they codified abortion in their state constitution. Of course they did. They said they would. Right? So when we think about Women's History Month, when we think about, the activities that are coming forward, I think it's really important that we really ground ourselves in how can we reimagine the future for, all people, but specifically, uterus having folks and people who socially and spiritually identify as women and femmes and girls. How can we think about that different? Then we're going to move into April, which will be Black Maternal Health Awareness Week. It will also be when the Supreme Court hears the Miffi-Pristone case. So that's a whole other conversation. But how are we thinking about the health of Black mothers? I think, again, the reason we want to activate citizens, the Momnibus has been introduced into every Congress since Lauren Underwood brought it in, and it's still not the law of the land. We saw yesterday, a bipartisan, immigration bill fall apart because people are lying. See, that's the other thing, right? People say, well, we're not going to allow for, money for Ukraine or money for Gaza or money for,
how can the Treasury afford such an expense? Yeah.
But then you say, oh, but we need a comprehensive immigration bill. You get that, and then the signpost is always moving. It's similar to racism, right? The minute you achieve, one milestone, then the signpost moves, and then you got to do something else. It's all a distraction. Toni Morrison was right. But then when we move into May, we're moving into National Nurses Week, and we're moving into the recognition of Florence Nightingale's birthday and all of that. And so the Robert Wood Johnson Foundation has funded Shift documentaries, and I'm featured in the second one that's coming out, which is about anti-racism. And I'm so excited because it was filmed exclusively here on the UW campus in my house. And it really sort of follows me throughout a day and looks at how do you start to operationalize anti-racism principles in individuals who happen to work within institutions. And so it's going to screen on May 10th in Washington, D.C. I'm super excited. I'm going. Many people that we know and love, including folks who are involved in the National Commission to Address Racism in Nursing from the American Nurses Association, are featured. And I think I haven't seen it yet, but I think it's just going to be really, really fascinating when it does come out. There's a second documentary I'm in that's called The Fight for Black Lives that's debuting actually this weekend, I believe, at the Santa Barbara Film Festival. And it was directed by Myceline Keels, who's a physician in Chicago. And it has a lot of social scientists, health sciences, historians, obstetrician gynecologists, really connecting the dots for the public about why this Black maternal health crisis, when you combine it with the premature death of Black people and the decreased life expectancy that we see of Black Americans in the United States, that we really have a potential recipe for disaster and how we can more upstream intervene in really, really making sure that, we can close the gaps in terms of the inequities and the disparities. And so I'm super excited about that. As we continue to think about the role of nurses in the public, as I am continuing to just design and think about programming and think about ways to change the future, one way the listeners can really start to think about this is if every person who belongs to a professional organization, whether it's medicine, nursing, pharmacy, dentistry, social work, public health, whatever it is, if we could propose a practice space at our professional conferences or annual meetings to really do upstander or bystander training, or to build skills in, anti-racism and equity, diversity, inclusion, whether it's proposing a simulation, using virtual reality goggles to help people to be in situations real time and then debrief those, whether or not I've done mock congressional briefings, at conferences to allow people to know what that looks like. I've done press conferences as a mock. We need to use our professional and our annual meetings to build skills, real life skills, not just to present research. We could do a simulation around how to conduct an anti-racist peer review of grants, of manuscripts in real time. We have got to take over our professional organizations and demand that they provide us the content, and that only comes from the participants. They're not just going to magically wave their magic wand and all of a sudden, right? So I am so generous with the ideas that I have in my head, for two reasons. Number one, I always know that there's going to be more. So if people want to co-opt them, that's fine. But then number two, I'm trying to activate people to think differently about how we're using the precious space that we have. Why are we paying thousands of dollars to go to conferences and be bored and or to review research findings that we can read in journals?
This conversation is happening across so many fields right now. This same conversation on LinkedIn. I was just on there yesterday, and everybody is like, no more conferences until they change, until they become more useful.
Right, so, because people have historically used them as information exchange, which is really important. But that's taken over, the creativity that we could have, or the curiosity.
What happens when you get a collective of people together?
Yeah, it's like, I feel like we're wasting each other's time. Like and part of that is because folks have to advance their careers, right? So let's get on that.
Right.
But that can't be everybody presenting at the conference. Right? When are we going to do some skill building? Right? Or when are we going to do some creative disruption? That's what I'm going to do. That's going to be fun. I'm doing some creative disruption because I'm done. So I think we need to think differently about how we can use those institutions and those professional organizations. And that's why I'm trying to plan some really creative programming in the next couple of months to help supplement and support faculty development. Right? So, we have been working with a couple of different vendors, and we're going to be offering some faculty development activities where people can get in real time, in classroom coach to help resolve, or to hold space for complex conversations with faculty and students, people who have no investment in the outcome, right? Almost like facilitators. So, and we're also thinking about how do we have peer-to-peer activities that don't feel like a checkbox, that really feel like engagement, that are designed to really help people to increase their confidence and their competence, right? So I want people, and I think the reason why so many people are feeling frustrated, demoralized, and burnt out is, number one, they believe the lies they've been told. All these false dichotomies that we're supposedly in. But then number two, they have no place to play at work. And I'm just about done with that.
Yes.
Right? I mean, part of the reason why I'm academic is I love the fact that I get to read and write for a living. Part of it is because I love being in front of classrooms and getting to teach students and to learn from them. But part of being an academic is getting to be weird, socially awkward, and goofy as hell. And what's the point of being a full professor and tenured?
Right.
You can't fire. You got lifetime appointment. So what you doing?
Right. Lifetime to play.
Use it. Have fun with it.
There's Lego in my office. So. I want people to have more fun, right? Because when we have more fun, that's where the weird, cool, strange, high risk, high reward ideas come from.
Right. I tell people all the time, your imagination is everything. You have to be able to imagine. If the only thing you can think about is what already exists, then we will fail every time, because what already exists
is not
working. You have to imagine. You have to exist in imagination.
But you can't imagine if you don't play.
If you don't play, and you can't exercise that creativity.
And one of the things that
right, exactly, is the ability to imagine.
If you can only think of what you know.
Or what has already
existed.
existed.
That's what an AI does.
Yeah.
It's based on all the data.
It's a regurgitation and a reorganization of what already exists.
Exactly. Absolutely. But imagination is that uniquely human thing.
Yeah, I completely agree. So I guess one thing I probably want to end on, because I got to go hang out with my students, is to think about I never like to leave people without understanding what the future of nursing is supposed to be, right? Or what I think it could be, or how we get to the future of nursing. I've given you 2 reasons why I'm a public scholar. A third one is I want to leave academia better than I found it. Right? I became a professor when I was 41, right? And I want more people to be excited about the professoriate and not waiting until it's time for their retirement to come, be retired in place and not do actual work. I want to unleash the creativity of nursing such that we stop thinking that the skills and tasks of nursing is the entirety of our discipline and our profession, right? I want us to think more broadly. At some point, I want us to acknowledge that one metric of success of institutions should be whether or not people who have previously used your services are your current employees. So Martha Ryan, who runs the homeless prenatal program in San Francisco, who is a mentor of mine, said years ago, I will know that I have created good infrastructure at homeless prenatal program if 25% of my current employees are people who have previously used my services. Because you make really different decisions about pathways for leadership if that's your philosophy. Because she was serving homeless people.
Right.
Her belief was so deep in homeless pregnant people that she foresaw them as her future workforce. I mean, think about that. Those are really different ways of organizing succession planning. It's different ways of organizing how you hire people. It's different ways of organizing who you partner with. So in my mind, I want early career nurses to view academia not as some weird, stuffy, traumatic, pain-filled thing that they have to get over, but as an option in their future employment. I love being a professor. It is a gift to be able to live an academic life. I am very aware of that. And however, I'm not going to retire as a professor. Let's be clear. I got other stuff to do. I don't know what that is yet, but I got other stuff to do. Yeah. And as long as our institutions, hire faculty for 40 years and you have to wait for somebody to retire in order to become a professor, I'm not participating in that. Somebody else deserves a shot at a tenure-track job, and they shouldn't have to wait for me to retire to get it. How about that?
Right. That's a big one.
Yes.
We're keeping that in.
Yeah,
we're
that's
keeping that
staying
in. That won't
in.
get cut out.
Somebody had to say it.
You're the first person that I've heard that is faculty that has said that.
Somebody had to say it.
Right.
Right. I live my values. So if there is some I started as a volunteer without salary faculty member. I was teaching a clinical class. When I got my first $250,000 grant, that's when they made me an adjunct. When a tenure-track job opened up, they asked me to diversify the pool, but they had no intention of actually giving me the job. It wasn't until the person turned the job down that they actually then offered it to me. As long as this is the machinery of how academia works, I'm not going to involve myself in that. So at some point, I'm going to relinquish a tenure-track job so that somebody else will have an opportunity to be tenured. I trust my track record. I can be a professor. I can go back to being an adjunct now. I got enough money and enough reputation that, and I've always said this, faculty should start with tenure and then have to work backward to continue to earn it. How about that?
How about that?
It was real serious.
Wow.
I'm just saying. We were serious about lifetime appointment. Start with one and earn it. That's how much I'm willing to put my money on where my mouth is. So I am, we need to play with the ways in which historically our institutions have been structured. Because we as a faculty could do that. Faculty governance, right? We own the curriculum, so.
She put it on the table. She
right.
did. She put it on the table.
Whatever. I mean, I the older I get, the more I understand power. And the more I understand that there are places that require courage in order to wield it. And there are people who hoard power and don't do anything with it. And I really despise those folks. They don't share it. They don't give it up. They don't, that drives me up a tree. So as I continue to think through my spheres of influence and unleashing what I know fundamentally, theoretically as a nurse, we are going to have to at some point disrupt all of the structures of academia, because nursing has survived for so long and has been so incredibly effective and trusted by society because the public understands one very fundamental thing about nursing, and that is nursing is shared work. It's not about any one individual. It's not about any sage on the stage. It's not about, oh, you're the lone physician that's responsible for the geographic care of this group of people. That's not the model under which we work or function. And going back to that collective wisdom, that collective strategy, that's how we will change the future.
If that's not the end of a podcast, I don't know what is.
That's good. That's good. I like that.
Thank you so much for joining us today, Dr. McLemore. Really appreciate your time.
Well, thank you for having me. I really appreciate having an opportunity to, push people to think differently about how we structure our world.
Thank you for tuning in to University of Washington School of Nursing's Voices of Nursing podcast. Join us next time as we continue to explore topics vital to nursing, health, and well-being. Until then, stay informed, stay inspired, and stay engaged. And don't forget, follow Voices of Nursing wherever you listen to your favorite podcasts so you'll get every show as soon as it's released.